Next speaker is Zeinab Raichouni. Zeinab has a BA in psychology from UFM Dearborn and a master's in clinical mental health counseling from Wayne State University. She started her clinical work at Access in Dearborn, Michigan, where she provided therapy and conducted support groups with survivors of domestic violence. Currently, Zeinab works with a Great Lakes psychology group in Dearborn, where she focuses on offering culturally competent care to individuals struggling with anxiety, depression, life transitions, trauma, identity crisis, and family issues. She also plays a significant role in the Mental Health Committee at the Islamic Institute of America. And despite all of these achievements, her greatest success is being a mother. Please help me welcome her up to the stage. Thank you.
Assalamu alaikum. Thank you for the introduction. I'm just curious, how can I pull up the presentation? This
Connecting to the probably there's a pistol in there now.
Alrighty, so how's everyone doing today? Alhamdulillah. So I like to get to know my audience. Before I go ahead and dive into the presentation I have prepared today, I'd like to start with an icebreaker. So where are my high schoolers at? Raise your hand. Okay. So whoever would like, no pressure to share, but feel free to introduce yourself and name one trait that makes you unique. No pressure. Or if you guys would just like to introduce yourself and mention what you're going into in college. Okay, I was gonna say that's what I was going to try next. All right, thanks for the permission. So let's start here. Yeah.
My name is Zeinab, and I'm a junior at Dearborn High, and I have no idea what job.
And that's okay. In college you'll explore that, inshallah, and you'll hopefully land something that interests you. Let's try back there. Nice, nice. How about right here? Yeah. Inshallah. Let's see. How about back there? Yeah, you. Nice. You said HR? Trade school. Nice, nice. How about right there? Next to you. Dentistry, inshallah. Let's see. What about right there? You're smiling at me, so you probably knew you were next. Inshallah, inshallah. Best of luck to you. How about our MC? Lawyer, nice. Okay, I sorry. You look really good. You're young. So, let's see who else. How about right there in the back? Yeah. Alrighty, inshallah. Anyone else would like to share? Alrighty, thank you guys for introducing yourself. I'm gonna start, before I start playing my presentation, I wanna let you guys know that I was at a point in life, I can actually say long ago now, I'm getting older, I was in your shoes. I was a high schooler trying to navigate my coursework, family, and being a teenager. I mean, it's not easy. You're going through many changes. You're about to transition out of high school, out into the real world, which comes with a lot of stress and pressure. And I think what sets us apart for people who look like us is that we're usually we're children of immigrants, or we're first generation, um, Arab Americans in this country. And that comes with barriers, challenges. You're trying to explore your identity, who you want to be. Um, as an Arab American living in the United States, immersed in a Western culture, while also inheriting the Middle Eastern culture, which definitely comes with its challenges. Do you guys agree, disagree? Okay. So it's tough to be in that position, and with regards to our mental health, you know, stress usually definitely impacts our mental health. And when we're under stress, we can suffer from different mental health conditions. We go through quite a bit. So, long story short, when I was in your position, I remember being a senior and struggling for the first time with my mental health. Um, 12 years ago, mental health wasn't really a conversation we were having in our community. Um, I did not know who to turn to. I would go to my school counselor, and God bless her soul, she was very helpful. But I didn't know who to talk to, who to reach out to. And I'm a daughter of an immigrant, and Allah khalle my parents, without them, I don't know where I would be today. But they didn't really know how to help me. So, and I mean, looking back, I think they did the best they could. So I think we're very grateful, alhamdulillah, to have these conversations in our community and know that if you are struggling, or if you do struggle in the future, ask for help, turn to people in your support system, seek out services. And what I'll talk about a little today is, I mean, I don't really have a long presentation. There's so many different things that we can talk about when it comes to mental health or mental illness. But I tried to focus on what I think was probably important. I thought back to when I was in your shoes, and I'm like, what would I have wanted to know? What information would have been helpful at the time? So I gathered this presentation based on my perspective of what it was like to be a high schooler and what I needed to know from a mental health perspective and about mental illness. Hopefully, I'm still relevant. I don't think I'm that old, so hopefully, we can connect, and this can be an interactive discussion as well. So feel free to ask questions at any point. So I'm gonna go ahead and dive in. So when you hear the term mental health, what comes to mind? I'll give you guys a few seconds before I start picking on people. It's pretty common. We all have mental health. So what comes to mind? Yeah. Yes. So how your brain functions, how you respond to your environment, Absolutely, that's a part of mental health. And I heard someone say weak. Can you elaborate on that, please? Absolutely. And I think that ties back to the stigma surrounding mental health and mental illness. We view mental illness as a weakness, although that's not true. And we view folks who struggle with their mental health as weak. But actually, let me tell you guys, as a therapist, we all struggle with our mental health at some point in life. We all have a brain, we all have mental health. And just like we get physically sick, our brain is predisposed also to responding to stressors, and different, as you face different life transitions. And absolutely, I think there's definitely a stigma surrounding mental health, but I'll tell you, as a therapist, some of the strongest individuals, the most resilient and empowered people struggle with their mental health. I see, resident physicians, I see doctors, lawyers, um, different folks in community who struggle with their mental health. They come into therapy to treat their mental health, to explore different parameters of their self, to learn new coping tools. And that does not make you a weak individual. They're actually still really successful at what they do. Anyone else would like to share, what comes to mind when you hear the term mental health? Yeah. Yeah, absolutely. So you did a good job there. So mental health deals with our brain. Anyone else would like to share? I think that was great. You're very insightful for your age. Anyone else would like to share before we move on to the concept of mental illness? Mazboot. Mazboot. Yeah, and there are definitely there's more than one component that makes up our mental health, and we'll actually dive into that on the next slide. And I'm curious, what mental illnesses do you guys know of? What comes to mind when you hear mental illness? Any specific ones you know of? Yeah, it's definitely a common one. Mhm. Absolutely. And those are the two most common ones, anxiety and depression. And it's almost like what came first, chicken or the egg? Did you get depressed first? Were you anxious first? And most of the time we see these two disorders together. Any other mental illnesses you guys are aware of? Yeah. Yes, bipolar, which is another common one. Schizophrenia, yes, which is common but not so common. And the age of onset is actually in a person's 20s. And one thing I like that you mentioned that. One thing I'd like to mention is as you go through this life transition, you're a teenager, 18, going on 19 and 20, there's definitely loads of stress that a person can experience. And I think it's so important as you transition to take care of your mental health, because usually some mental illnesses, the age of onset is typically around late teenage, early 20s to mid 20s, depending on the disorder. So you really want to take care of yourself. You want to keep stress within a manageable limit. I'm not going to say like anyone can successfully eliminate stress. And if you can, we'll have to talk after. You have to teach me a thing or two. So try to keep stress within a manageable limit. You can do that, through different methods like exercising, journaling, mindfulness, deep breathing, seeking out your support system, continuing to immerse yourself in a sense of community. So mental health includes our psychological, emotional, and social well-being. So psychological, I mean, that's our brain. We have to take care of our brain, and we can do that through exercise, because exercise increases endorphins, serotonin, the good hormones that make you feel good. And research actually suggests regular exercise is actually just as effective as a mild antidepressant. So exercise is preventative, it's protective, and it's treatment at the end of the day. Um, and in terms of our emotional well-being, what usually helps with that is a multitude of different things, such as spirituality, sometimes seeking out therapy, talking to people in our support system when we're struggling, and social well-being. When we go to college, it's a time where we're so occupied with studying, we're always at the library, um, and our parents probably fight with us to go home. Like, I never see you, you're always busy. At least my parents did here and there, but I tried my best to always, see my parents, reach out to them because it's so important. Silat al-Rahim is so important in Islam to keep kinship strong. And living in a predominantly Western community, we hear a lot about boundaries, focusing on ourselves, and we live in a highly individualistic society. And this is the Western society, and we come from a collectivistic culture where there's a sense of togetherness, and family is very important. And family is very protective, guys. Don't go to college and forget about, where you came from and who your family was. Continue to keep that relationship strong because it's very protective, and family is all you have, no matter, where you go in life, no matter who you become. I think roots and having a strong relationship with family will protect you lifelong, and you will pass down, inshallah, those values from generation to generation. Um, a mental disorder is characterized by a clinically significant disturbance in an individual's cognition, emotional regulation, and behavior. So some folks, say, I'm so depressed or I'm so anxious, and not to say that people have a tendency to exaggerate, but not like if you experience stress for 2 days, you don't necessarily have like an anxiety disorder. If you are sad for like a day or two, if something has gone wrong in your life, um, you don't have clinical depression. I think normal variations in emotion are healthy, they're okay, it's how we respond to our environment. But we're talking about disordered um, behaviors. When it becomes persistent that you're feeling depressed for or sad for more than 2 weeks, or you're feeling irritable, or you notice your family is starting to say, hey, you know you're starting to change. So typically as a therapist, we look for duration. We see, the level of intensity when it comes to symptoms. And sometimes, people are usually going through an adjustment disorder where it's, you're experiencing mild depression, mild anxiety due to an adjustment. And it's not uncommon, to experience that, let's say, when you start college. It looks very different. You're managing, a large workload, so it's not uncommon, and it's okay to struggle with your mental health or experience a mental disorder. It doesn't make you flawed or weak. And how do we care for our mental health? First and foremost, we have to challenge the stigma. We have to have these discussions. We have to, break the silence around mental health. Now, I know that we've been having discussions in our community, which is great, but there's still definitely a silence where people aren't comfortable talking about their mental health. So I encourage you guys, when you go off to college, if you see a friend struggling, you notice behavior change, you notice this friend is withdrawn, ask them, hey, how has your mental health been? You'll be surprised. Some people are struggling and they want someone to ask how they're doing and how they're really doing, because we're used to the generic response of alhamdulillah, I'm doing good, even when our friends are struggling. So ask them, how are you really doing? um, Also, utilizing protective factors, like I mentioned earlier, spirituality. um, Now, spirituality is not a treatment for mental disorders. So I encourage people that, although Islam is a very strong tool, there are so many tools to utilize within spirituality. It's not treatment. So if you're struggling with your mental health, or with you're going through depression or anxiety, continue to pray, because it will continue to give you hope. Allah subhanahu wa ta'ala will continue to help you to remain patient and to steadfast. But it's important to also seek out proper treatment for your mental health, but spirituality is still very protective. Um, like I mentioned earlier, family is very important. The last thing you want to do is go off to college and start isolating and making that your only goal. I think it's important to continue to focus on different areas of your life as you nurture, your potential, as you nurture that part of your life. School becomes like college becomes a part of your life. Nurture that, right? But don't neglect other areas, such as your social life, such as family. Continue to maintain connection. Go to family functions when you can. See cousins, see family. I think it's very important. We already mentioned exercise. Have goals other than school. Work on different aspects of your identity. I think it's so important because being children of immigrants, we play tug of war with our the aspect of our identity that's individualistic, and we're constantly being pulled in the direction to embrace collectivism, which usually causes identity crisis. And it's not uncommon to see identity crisis, when people go to college at the end of high school. They're like, oh, wow, like I'm transitioning. Who do I want to be? What do I want to do exactly? So people end up confused. But if you're confused, I'm telling you, that's absolutely okay. It's healthy. Seek out mentors, seek out people in your support system, seek out the right type of people. Continue to I recommend, think of your values, go back to your morals, and use those to guide you as you explore your identity, as you work towards identity achievement. Another one that's, I think, very prevalent in today's society is drugs. I urge you to abstain from drugs. There are other outlets for you if you're struggling. There are resources that are available. Tap into them. Reach out to the counseling center on campus. There are usually therapists and it's free. You can see a therapist on campus free of charge. If you have insurance, depending on what your insurance is, you can hop online, look at Psychology Today, see who may be a good fit for you. Um, and seek out proper treatment. There are support groups in the community that you can join, exercise and utilize different protective factors. Don't lose hope, because drugs will alter your brain, and unfortunately the damage is long lasting. For example, marijuana is a hot topic. Many people use it, unfortunately, to achieve that calm, to clear their mind. But let me tell you guys, people who use marijuana, starting in adolescence, and if they have a predisposition for, let's say, schizophrenia, that marijuana use will alter the development of your prefrontal cortex, which is responsible for decision making, and which is usually still premature when you guys are adolescents. And using marijuana will actually activate sometimes psychotic illnesses, increase paranoia, and unfortunately, the damage cannot be reversed. So stay away from drugs, from alcohol, from marijuana, medications that are not prescribed to you, you know, um, and seek out treatment and appropriate treatment, which I'll go into in a moment. Also, identify warning signs. If you start to feel withdrawn, if you notice others in your environment are starting to change, like, hey, I used to go to high school with this person and they were full of life, and all of a sudden they're dull now. Reach out to that friend, see how they're doing. Encourage them, if you guys have that type of relationship, to seek help. Ask for help when you need it. Don't be afraid to turn to your parents and let them know what you're going through. Turn to family, turn to trusted individuals, because they will help you most. So now we're going into mental disorders. Common disorders that are seen in college students, which is, you guys already mentioned a few of these. Depression, some symptoms of depression are feeling sad, feeling anger, changes in sleep, changes in appetite, you're withdrawn socially, having trouble focusing, anxiety, which is excessive worry, feelings of stress, irritability, headaches, muscle tension, shortness of breath, upset stomach, also substance misuse, which usually results in slurred speech, anxiety, paranoia, changes in appearance, also dependence to drugs, and increased tolerance. So let's say you start off with using, I don't know, like I've alhamdulillah never used drugs, so I don't know what the go about is with that. But let's say you start off utilizing a certain amount of, a prescription drug, a certain amount of milligrams, and all of a sudden you find yourself using more and more and more of that, and increasing your tolerance, and you need more of that drug. And there are individuals who may use drugs and it doesn't really affect them. And there are people who have a genetic predisposition to becoming addicted. So it's very mindful to just stay away from drugs altogether. Don't even try to experiment, because there are gateway drugs like marijuana. You start off with using that and you end up on, God forbid, heroin. So it never stops with marijuana or with prescription drugs. Another one is suicidal ideation and intent. Now, this is not necessarily a disorder in and of itself. It's usually seen with a symptom of other disorders, such as depression, anxiety, substance use. So I urge you that when you start to feel depressed or sad for 2 weeks or longer, or anxious, and you're having a very hard time managing your stress, seek out treatment. Start seeing a therapist, someone who's culturally competent, someone who's able to understand your perspective and where you come from in the world, and why you are who you are, and not someone who's going to steer you away from tradition and culture. Not to say that my fellow colleagues who are outside of the culture do this, but it happens sometimes. Suicidal ideation and intent. You usually see changes in mood, behavior, and speech. People start to become persistently sad. They become withdrawn. This is a behavior we see. They become withdrawn. They stop showing up to class. And if you notice these things in yourself, if you have a hard time getting out of bed in the morning, you have a hard time, focusing with your studies, if you are having a hard time keeping up with hygiene, you're not in the mood to shower, you can notice this in yourself or others. And usually, this is the time when, let's say, a mental disorder has become more severe. So I urge you, seek out treatment when symptoms are just mild or moderate. Don't wait until they become severe and then come into therapy, because that's usually what happens. People are struggling and they're having such a hard time, and they come into therapy, and it takes a lot longer, to see progress sometimes when individuals are already that severe. And then speech, be mindful of like what people are saying. If they start to like make goodbyes, if they start to say things like, I wish I was never here. And sometimes people who have been depressed for so long become happy all of a sudden. So if you see just like a flip of a switch, and they become happy all of a sudden, and they're giving away belongings, and they seem like they're at peace with, God forbid, the decision to complete suicide, that's also very alarming. There is the suicide hotline. I should have actually put the number up here. You can reach out to them if you know of a loved one, or if you are experiencing that, or call 911. They'll come and they'll get you to a person who can help. These are some stats. I'm not going to read them because you guys see them, and no one really loves stats, but I just put them there for credibility. Alrighty, so some treatment options are therapy, psychiatric care, group therapy, and support groups. Let me just check how I'm doing. Oh, okay. I have like 1 minute left. I'll wrap up quickly. Therapy. I'm a therapist. We do talk therapy. We utilize different evidence-based interventions and techniques. It's a non-judgmental place where you can come talk about your issues. I'm not going to judge you. I'm not going to be biased. It's someone who's there to listen and to ultimately help you, challenge you where you need to be challenged, and push you towards growth, and also provide to you the right resources that'll help you. Now, therapists don't prescribe medications, and there's usually a big misconception in our community because I've heard this often. We don't prescribe medications, we don't encourage, I mean, we don't push medications. And I don't encourage medications because it's not my territory, but I do let clients know, hey, they're there if you need them. Seek out psychiatric care. Psychiatrists are usually MDs or DOs. They can prescribe medications, and they're usually very equipped with the right training to manage medications. Don't take medications from someone who's not trained. I mean, PCPs are usually also people, your primary care provider is someone you can talk to if you're struggling with your mental health, or a psychiatrist. Don't just take it upon yourself and take medication to cope with your mental illness or with your mental health. Group therapy and support groups. Group therapy is usually comprised of 5 to 10 people. It's where you can, talk. It's a treatment-focused group. Support groups are what you guys see in the community. They're not confidential. Group therapy and therapy is confidential. Your information, what you talk about, doesn't go anywhere. It stays between you and the therapist. Or unless you're a threat to yourself or a threat to anyone else, then confidentiality is broken. Support groups are not confidential, so if you do seek them out, be mindful of that point. So that's all I have for you guys today. Any questions? I know we may not have time for that, but I can probably, I'm not sure if there's time for questions after the event. Okay. So stigma is a negative perspective, that's placed on mental health. So there are misconceptions. So a stigma is a misconception. Let's say an example of a stigma is people who have depression are weak. People who have anxiety don't tolerate stress well. Let's say, are there any other stigmas that you guys would like to mention that you guys hear of often when it comes to mental health or mental disorders? One I can think of, go ahead, yes. Yes, so that's another stigma, is that treatment is not an option. Oh, you're not that depressed. Come on, you don't need therapy. There's nothing wrong with seeking out treatment. And like I said, so therapists are trained individuals. We've gone to school for 7 to 8 years. We have the knowledge and the resources and the techniques and the skill set to treat mental illness. While prayer and religion is very helpful and resourceful, it protects your mental health. It's preventative. Let's say it's sometimes what stops depression from going from mild to moderate or severe, and it's usually sometimes spirituality that protects you. Any other stigmas that you guys are aware of, or any other questions you guys have? Alrighty, oh yeah, go ahead.
What is if males struggle because we so especially like society or whatever, men are usually more afraid to speak up about it.
Yeah, absolutely. And I think for those of you who didn't hear her, she was mentioning that men usually struggle, and they struggle in silence ultimately. And sometimes and feel free to challenge me. I think it's rooted in culture and society. Men are supposed to be strong. Men are supposed to not cry. Like we've all heard this when we were younger. "أنت شاب ما تبكي," and don't cry. So we expect men to not have emotions, even though they do, and that's absolutely okay. So I recommend men to seek out treatment as well and to break that silence and challenge societal norms. Any other questions? Alrighty, if there are no more questions, I'd like to thank you for your time today and best of luck in your journey. And salam alaikum.